Hi, my name is Mickey and I'm going to be going over some oxygen therapy devices to be used on a patient. We're going to be starting off with the nasal cannula. The nasal cannula, its flow ranges are 1/4 to 6 liters per minute on an adult and below 2 liters per minute on an infant. The FiO2 ranges on this one is 22 to 40% and the FiO2 stability on this one is a variable. Some advantages to this nasal cannula is that it is easy to use, it's disposable, and it's inexpensive. And some disadvantages to the nasal cannula is being the fact that it's going to be placed in the patient's nose. It could cause some discomfort to the patient and could cause some dryness to the patient's nose and also some possible nosebleeds. The best use for the nasal cannula is for stable patients needing long-term low FiO2. And the way that we're going to be placing the nasal cannula on a patient is that there are some prongs right here attached, okay? And there's some prongs that come curved. And if they're curved, you want to make sure that that curvature goes downward inside the patient's nose. And you're going to go ahead and just put him inside the patient's nose, nostril, one for each nostril. Place this over the patient's ears. And there is an adjuster here, so you could go ahead and adjust this. Just go ahead and go up, make sure that you don't choke the patient. And that way it's a nice snug fit for the patient, okay? And you just go ahead and lower this down to go ahead and remove him from the patient. And this is the nasal cannula. We're going to go ahead and move on to the simple mask. The simple mask, the flow ranges for the simple mask is 5 to 10 liters per minute. The FiO2 range on the simple mask is 35 to 50%. And the FiO2 stability on the patient, on the mask, should I say, is it's a variable. The advantages to this is that it's easy to use, it's disposable, and it is inexpensive. The disadvantages to this is that it has to be removed in order to be able to eat. It could block some vomit on unconscious patients. And the best use for the simple mask is for emergency situations for patients needing moderate FiO2. And the way that you're going to be placing the simple mask is you're going to be placing it over the patient's nose and mouth, which I will demonstrate in a bit. I just want to make sure that you see that there's a little bit of a wire right here, and this is going to be you're going to go ahead and pinch it at the on top of the patient's nose. That way you can make sure that it's a snug, secure fit onto the patient, okay? And so this is the way that it's going to be placed. Just like this. Just pinch it here at the bridge of the nose. And make sure that it's a snug, secure fit for the patient. To remove it, you just want to hold the mask in place, remove the straps, and you could just go ahead and remove it. And this is the simple mask. We're now going to be moving on to the non-rebreather mask. This one, the flow range on this one is higher than 10 liters per minute. The FiO2 range is 60 to 80%, and the FiO2 stability on this one is a variable. The advantages to the non-rebreather is the same as a simple mask as far as it being easy to use, it is inexpensive, and it is disposable. The disadvantages to this is the same thing as a simple mask as well. It has to be removed in order to eat. It could be uncomfortable for the patient, and it could block the vomit on an unconscious patient, and it could cause some suffocation. Now, the best use for this type of mask is best used for patients who just came out of a fire, or also on patients who need a high FiO2. And this one, it has an attached reservoir bag to it. So prior to placing this on a patient, you want to make sure that this reservoir bag works. And in order to be able to determine that is once you plug this into the wall, to the oxygen, you just go ahead and put your thumb over in here, right in there, okay? And the bag should inflate. If it does not inflate, then that means that it's a non-working mask. Therefore, you want to make sure that you replace it to place the proper mask on the patient with a working reservoir bag. And the same thing is, you're just going to go ahead and place it over the patient's face and nose. Put the strap over, just like this. And then to remove it, you're just going to hold the mask in place and just remove just like that. This is the reservoir and the non-rebreathing mask, should I say. On to the last mask. This mask is the AEM mask, which is also known as the air entrainment mask, or also known as the Venturi mask. For this one, the flow range on this one is greater than 60 liters per minute. The FiO2 range is 24 to 50%, and this one is actually a fixed FiO2. The advantages to this one is that it's also easy to use, it is disposable, and it is inexpensive. The disadvantages to this one is that it also needs to be removed in order to eat. It's loud, pretty noisy, and uncomfortable for the patient. The best use for a Venturi mask is for patients needing precise low FiO2. Now on this one, the difference is that this one actually comes with some ports attached to it, because again, it's a fixed FiO2. Therefore, these ports are going to give you your fixed FiO2. And the way you kind of have a little bit of a guide to know which flow ranges you could use on these ports, because underneath it supplies you with the flow range for the gas, and also the percentage, the FiO2. So for example, on this one, it says 20 liters per minute, and it's a 50%, okay? So if you just look underneath each one of them, this one has 6 liters per minute, and it is at 31%. This one is a 4 liters per minute, and this one is at 28%. This one is at 8 liters per minute, and it's at 35%. The next one is at 8 liters per minute, and it is at 40%. I know I'm showing you, but you really can't see it. That's what I'm telling you. And this one is at 4 liters per minute, and the FiO2 is at 24%. So you just want to make sure that you get the correct ones. Don't just grab them by the color. That's not the best way to do it. You just want to make sure you grab it and you take a look at it, because you want to make sure that you're giving the patient the proper FiO2 that they are requiring. And then you just go ahead and you just place it on right here. And then it has a little cap right here, and this is used, basically this covers the little port, because as you can tell, the ports have little holes, entranceways in here. And if it's placed, there's a patient that is lying down on the bed and is using one of these Venturi masks, and the blankets go over it, it's going to be blocking. So therefore, they're not going to be receiving the proper FiO2. So if you use this little cap, you just block it. And in case the blankets go over it, it's not blocking the ports, and they're still receiving the proper FiO2 that they're supposed to be receiving. And again, this is the Venturi mask. And so we've had a demonstration of all 4 different devices that are being able to use to give oxygen therapy on a patient. Thank you.